And we've been seeing lots of queries, as you could imagine, in relation to health and safety issues and how people can keep their workforce safe at such a sort of difficult time. And what I would say is the regulator is also trying to work out how to operate in such a difficult time. So I will try my best to deal with as many sort of queries and questions as possible, but I probably, and not necessarily, will have all of the answers, but hopefully it gives something to for you to think about. So just moving on to the next slide. In terms of just the general structure, there's sort of two parts to this. The first part is you have to bear with me. I suppose I better talk about the law, and I'll keep it very brief and to the point. But I think it's useful just to go over the basics there and give you the framework in which you're operating within. And then there'll be a pause at that point for questions. And then the second half will be looking at specific issues which are particularly relevant to the automotive industry. So we've just got a list there looking at statutory inspections, medicals, first aid, home working, mental health, and reporting requirements. So just moving on to the general legal position. Hopefully this will be familiar to most of you. The law's fairly straightforward. It's basically says there's a general duty for all employers, all businesses essentially, to take all reasonably practicable steps. And I'll just abbreviate that, it's quite a mouthful, to just all reasonable steps to ensure the safety of anyone who might be exposed to risk as a result of your business. And when we say anyone, that includes employees. Obviously, they need to have a safe working environment, but the duty also extends to anyone else that might be affected by your business. So typically that would be contractors coming on site, whether they're engineers, whether they're health professionals, whether they're visitors, or more generally members of the public who also might be at risk by your activities. So that is a very broad and general duty, and that's under the Health and Safety at Work Act. And then there are I think over 200 bits of other legislation that look at particular duties and particular scenarios, and they sort of supplement that general duty. And one of those, just moving on to the next slide, is the management of health and safety at work regulations. And it's very clear that businesses have to make a suitable and sufficient risk assessment, effectively, of any risks that their employees might be exposed to, and again, anyone else who might be exposed to those risks which are created by your business. So just focusing really on sort of COVID-19, the bottom line is businesses have a legal duty to take steps to make sure the working environment is safe. How do you do that? Well, it's like any other risk, such as manual handling. You've got to conduct a risk assessment, and then that risk assessment will identify or help you identify the control measures or the steps that you need to take to control that risk. So just moving on to the next slide. In terms of risk assessment, I imagine most of you on the call will have been involved with this process of trying to understand how best to protect your business and your workforce. And there is no sort of one-size-fits-all solution. It really does depend on your particular business and how it operates. But what I'd like to do is just talk through a few issues that you may or may not have thought about, and just place a different emphasis on areas that people neglect, because the obvious risk is obviously the spread of the disease and how you sort of deal with that, but it can have a number of knock-on effects that I'd just like to talk through. So the first point I've raised there is when looking at risk assessment, it's not just employees, it is everyone who plays a part in your business. That could be people coming on site to make deliveries of parts. It could be external cleaning workers, it could be the operational members of staff, it could be management, it could be the office workers. It really doesn't matter. You need to consider the risk of everyone who plays a part and role in your business. And in particular, it's I think from conversations I've had, a lot of people have started by looking at people who are a particular risk or higher risk than the average person. And the government has produced guidance to explain who is classified as extremely vulnerable. That includes people, for example, recovering or undergoing cancer treatment. And then and in terms of that group of people, the guidance is fairly clear that they should be shielded and, where possible, told to stay home, and businesses should be supporting them to do that. The more difficult issue is, well, there are other people who are not extremely vulnerable that are still at higher risk, and I've just called that just vulnerable. And there are lots of debates about, well, who is vulnerable. Some people may think they're vulnerable, but other people may not necessarily agree. And I think my sort of take on this is that communication is really important. And I think the message to businesses is to speak to your workforce, speak to everyone within your business, and invite them to engage in that discussion with you if they have particular concerns, because it's really difficult for you to be able to do something to help them if you're not aware of their particular circumstances. And that could range from someone who is caring for an extremely vulnerable person, for example, to someone who may have a health issue that's not necessarily covered by the extremely vulnerable category. The next point I'd like to raise is the knock-on effect, because the government guidance or the guidance from the regulators are that you should be following the steps recommended in the government guidance, and the key step is sort of social distancing, so trying to maintain a sort of 2-meter distance between people. But that can have a number of implications on existing control measures within the workplace. So I think we sort of discussing this yesterday, and this is often overlooked, because if you implement a new procedure or modify an existing piece of equipment or an existing process or policy, you've got to really work through what the implications of that will be. And I think as a rough and ready guide, my view is, number one, consult the government guidance. What does it have to say on the topic? Number two, what does the law have to say on the topic? Is what you're proposing to do lawful? And finally, consider the implications of that from a practical perspective. So if I take an example of a piece of machinery, and it's considered that you'd like to change or modify that piece of machinery to try and reduce the risk of spreading COVID-19, then thinking through those steps, well, has that perhaps invalidated any sort of CE marking or declaration of conformity? Has it impacted the sort of safety features of that piece of machinery? That may present higher risks than the spread of COVID-19. And it may have other effects. So people may actually decide not to use the machine and end up doing something entirely different that they're not trained to do or not competent to do. So that's just one example. You can apply that approach across all sorts of issues, but it's just one to be aware of. Just because you're implementing government guidance, it doesn't mean to say it won't have an impact on other or the safety of other tasks. The next point HSE have sort of stressed is that you've got to look at human factors as well. So essentially, what are the implications of the changes that you've had to make on your workforce? And the most obvious one is if you're requiring people to work longer hours or different shift patterns, will this result in fatigue Does that increase the risk, particularly if people are driving, for example? Does that create additional hazards that you need to manage? The next issue shouldn't be overlooked at all, and I'll come on to this in more detail, but the risks to mental health should also be considered as part of an assessment of the risk. Is that, everyone understandably is very worried about the current situation. It's unprecedented, it's not usual, and it places strains on people's finances, concern about their friends and family, and they may have different working arrangements, which can bring other challenges. And again, I'll come on to that later. And finally, I guess this is particularly pertinent to the automotive industry. If you have less people available due to illness, or they're self-isolating, for example, it will place a strain on the existing workforce. And there's a temptation there for people to start acting up in roles they've never done before. You may not have, or you may have pockets of or groups of people performing a particular task, and all of a sudden they're no longer in the business, which leaves a gap. And it's quite easy to fill that gap with people, but the critical point they have highlighted is that people must have the relevant training, instruction, and competence to be able to do what they're being asked to do. Yes, it is unprecedented circumstances, but the key point is your duties still remain, and the workplace has to be safe. And if you can't do that, then you have to give serious consideration to stopping that particular activity until such time as you can manage that particular risk. So just moving on to the next slide. So I mentioned, so if you looked at risk, the next step is, well, what are the reasonable steps to take to manage those risks? And the Health and Safety Executive, the regulators' guidance is very clear that you should be following the current Public Health England and government guidance. And the view is, if you are doing that, it is more than likely you're taking all reasonable steps. And I put together these slides at the end of last week, and as I was looking at the up-to-date position this morning, HSE and the government has published updated guidance specific to manufacturers, and that was published yesterday, which is really, if you haven't seen that already, I definitely recommend you look at that. They've sort of caught up on the sort of common themes and issues that people are facing, and produced much more focused guidance for business. And I just thought you may find it interesting to learn about the comments particular to manufacturing. And in essence, and I'll just summarize this, the guidance is, you need to carefully look at a particular activity, and if it's not possible to sort of implement the sort of social distancing rules, the first question should be, well, should that activity continue? If it has to continue because it's absolutely essential to the business operation, then the advice is, well, you've got to take all possible steps to mitigate the risk of the virus spreading. And it gives you a number of pointers, including sort of workers not facing each other, it could be side to side, increased frequency of cleaning, and sort of stopping production at regular intervals to allow that to happen, assigning staff to the same shift patterns, so it minimises movement between different groups of people, looking at places where people tend to congregate, so it could be sort of canteens perhaps, or smoking areas, or restrooms, whatever that is. That's another issue to look at. How people enter and leave the premises, sort of staggering shift patterns to try and address a mass influx of people all at once, and the same again at the end of the day. And also communication, which I'll keep mentioning throughout this presentation, so I think that's absolutely crucial, so people know exactly what they should be doing, and they're sort of reassured that you are doing everything you possibly can do to make sure that they can come to work and in a safe environment. As I say, the developments are, or the situation is developing on a day-by-day basis. So I'd recommend you keep reviewing the guidance at least once a day, because it does change and is changing. Just moving on to the next slide. One of the key recommendations, or one of the key thrusts of the government guidance, or PHE guidance, is sort of social distancing. And I think it's fair to say people have struggled with this, particularly in the manufacturing environment, where sometimes it is just not physically possible to be able to operate with a 2-metre distance between people. And that was clear. And so the HSE, in conjunction with others, published a statement to try and address the situation. And to my mind, it just sort of slightly muddied the waters and isn't particularly clear. But it emphasises that businesses that are permitted to stay open should do. HSE is very supportive of businesses that are trying to implement the guidance, and that is the principle that everyone should be trying to adhere to, and that includes social distancing. But I think it recognises, which is the text I've highlighted in red, that sometimes it is just not practical to do that. And as I sort of mentioned, the guidance published yesterday sort of now recognises that and suggests ways in which you, or control measures that you can implement to deal with that. Just moving on to the next slide. Before we break to sort of take all that on board, I just want to mention generally the approach of the Health and Safety Executive to regulating. So as I say, they are faced with the same challenges. They also have a workforce to protect, at the same time trying to conduct their normal regulatory activities. And there's a statement on the HSE's website, and I've just picked some of the key points from that. But essentially, they're adopting a flexible and pragmatic approach and trying to adjust like everyone else. They've announced that they've suspended targeted inspections of activity or industries that aren't considered to be in major hazard sectors, and that would include manufacturing. So there shouldn't be any sort of focused inspections on manufacturing facilities. But that said, that doesn't mean they're ignoring non-compliance. Quite the opposite. HSE have said that they'll try their best to continue working remotely where possible, and they will conduct site visits to reassure the public that they are managing safety, and so they will be conducting visits when it's safe for them to do so and, in their view, necessary. Moving on to the next slide. So that was a sort of whistle-stop tour of the general approach, risk assessment, and control measures. I'm not sure if anyone has any questions or would like to raise any points in relation to those issues.
Just unmute yourselves if you have a specific question, and we can field them that way.
Hi, Ashley, it's Stuart. With regards to the automotive sector, they tend to get things done rather quickly. So before you know it, you've got a task force and you're putting a lot of stuff in, and everybody's got some great ideas.
Yep.
But what's a sort of standard up you should follow, you know, to question? So if you're going to change something in your process, is it a 3-step process or something that you should just sanity check everything with? You know, as you're sort of like all hands on deck getting stuff done. I think it's easy to, you know, lose sight of some of the things you've got to have in the back of your mind for any change you put in. Does that make sense?
Yeah, and I sort of touched on it as part of the risk assessment process, but I think it's worth sort of emphasising it. And again, this is just a personal approach. because I think most people are familiar with a sort of change of modification of process procedure if you were installing a new line from an engineer's point of view, in terms of, do you need, how are you going to get the electric supplied to it, how are we going to do this, how are we going to do that. And it's a very similar process from a health and safety perspective. But I think the first thing is to look at government guidance. What does it say that you should be considering, and what control measures does it suggest you should be putting in place before you start doing anything?
Mm-hmm.
The second, it might be it's silent, in which case you need to, or if it's not, then consider what does the law have to say. So I think the example I gave is if you modify machinery, sometimes that can have impacts on the validity of insurance, for example. It can create additional risks that have nothing to do with COVID-19.
Mm-hmm.
So that may actually put you in breach of other duties. And then finally, just think through the consequences of the change from a practical perspective. And I'll give another example of, not allowing people to smoke in a particular area, or not allowing people to eat food in a particular area. Well, practically, what does that mean? Where are people going to go for food? Do you want people going in and out of your premises? You've taken all that time to stagger shift patterns, only to find that everyone leaves at lunchtime all at once. So that's just a sort of very basic example, but that's the approach that I'd take.
So basically, guidelines, law, consequences.
Yes.
That's the thought process. Great,
Yeah.
That's excellent. Very clear. Thank you. Are there any more questions?
Quick question, if that's all right.
Yeah.
Lily from Adient.
Hi, Ellie.
Hiya, you're right. We're thinking about introducing thermal imaging for a bit of a pre-screen for their health before they enter site. Have you got any advice on the actions that should be taken before we implement this?
Yeah, there's been lots of discussion around screening, health checks, and it's a difficult one, because I can understand exactly why you would want to do that. But what I would say is, I think you need to very carefully, or consider very carefully, any sort of data protection issues. And I've been on calls, particularly with the chemical industry, who were sort of considering, or have been considering, sort of testing people, contractors, before they're allowed on site. People have returned to work, etc. And I think the overwhelming view was you need to very take advice on the sort of data protection or implications of that, because anything, I mean, I'm not a data specialist, but that is sort of sensitive data, and you need a legal basis to be able to use and process that data. So
Okay.
that would be my advice. Just that needs to be given some thought.
Yeah, brilliant. Thank you.
Got one other one, Ashley. Not sure if we've touched on it or not. What happens if you've got a skeleton crew in and somebody has a heart attack or somebody takes ill? What do you do?
Yeah. So I'll come on to first aid as part of the sort of particular issues. But I imagine, from leaving the law aside, most people's reaction would be to help any individual that is ill in the workplace.
Mm-hmm.
And I was just looking at the updated guidance today, and the government has published more detailed guidance as to what you should do in that situation. And interestingly, it deals with the situation where you have an employee who has symptoms of COVID-19, and it sort of sets out what the procedure is to follow. Essentially, that person needs to get home as quickly as possible. And interestingly, it says that an employee can assist them, but would need to take precautions to prevent themselves from also being infected. So that could be PPE, that could be simple sort of hand washing, all those control measures. And I think my view is that should form part of any sort of first aid risk assessment, which is another strand of risk assessment. You know, what is the procedure, so people know, because in those situations you don't have time to read a thesis on, you know, control measures, etc. It needs to be a sort of practical guide as to exactly who can assist that person and what steps that person needs to take to make sure they're safe.
Okay, thank you.
It is difficult though, because in the legal world there's debates around, well, what if sort of CPR is required, and you know the implications of that. And I think that's slightly academic, to be honest. But I think the bottom line is you need to give particular consideration to first aid and responders.
It's a minefield, isn't it?
It is. Are there any other questions before I sort of move on to the sort of particular issues? No, I'll move on then, if that's okay, to looking at getting into sort of more the nitty gritty. The first issue is sort of statutory inspection and testing. We've had a lot of queries in relation to this issue, because most people will be familiar with sort of the legal requirements to have particular bits of equipment examined and tested by competent people at particular points in time. So every 6 months, for example, or every year. And a power press is a good example of that. If you've got a production line, you know, that those bits of kit are required to be inspected every 6 months or so. But the problem is, if the engineers are not available, what do you do? And the HSE hasn't, as far as I'm aware, given any particular guidance on this issue. So the position remains that there's no derogation, there's no extension, there's no relaxation of these requirements. And the bottom line is that all workplace equipment must be safe for use. So if you have a machine that is required to be inspected, say by, I don't know, the 15th of April, it's not possible to get the engineers to inspect it, then careful consideration needs to be given to the continued use of that machine. One, from a safety perspective, and two, it may also have knock-on effects for any insurance cover. I suspect most policies would require people to ensure that it's only used during its inspection periods, and cover would be invalidated if not. So that's one to be alive to, that just because you can't access the relevant resource, it doesn't mean to say you can sort of disregard the underlying legal position there. And interesting, the Irish equivalent of the HSE, the HSA, they've been a bit more particular in their guidance, and the view from the Irish regulator is that they're going to take a more pragmatic approach, and they've said that exactly the same thing, that the key thing is the equipment is safe, but if they do find non-compliance, they're going to take a pragmatic approach and take all the factual circumstances into consideration. So that could be, you know, why it wasn't inspected, has anyone done a risk assessment before it was sort of used, were there any obvious issues, what sort of training have people had to use it, what sort of frequency of the maintenance team have been looking at this piece of kit. So all of those factors the Irish regulator will take into account, which is a fairly pragmatic approach, but it's HSE in England hasn't said the same thing as far as I'm aware. So just moving on to the next issue. So medical and health surveillance. Again, certain employees that are involved in particular work activities or exposed to certain things like vibration, noise, asbestos, or hazardous substances are required to undergo effectively medicals every so often. And again, there have been problems with the availability of occupational health specialists, medical professionals to undertake those tests, or even if they are available, how on earth do they do that safely without exposing themselves to the risk of COVID-19? And HC has been has published on its website a sort of temporary sort of workaround, and effectively it's permitted a number of sort of medical surveillance checks to be conducted remotely, so effectively over the telephone in a number of circumstances. And it's also allowed people to defer those tests in a number of circumstances, particularly in relation to noise. So essentially they can be, so long as that particular person doesn't have any obvious issues, those tests can be deferred by 3 months. But again, you need to look at the guidance, because each type of risk has its own guidance. So vibration is different to noise, which is different from asbestos. And I think I've also had questions around sort of drivers' medicals, so HGV drivers, and issues there where their medical's coming up for renewal, but it's the same issue with being able to access the relevant people to be able to renew that medical. And again, the guidance has been updated on HSE website to address this particular issue, which I thought you may find of interest. And I think the summary of that is, if the renewal was or expires on or after the 16th of March, it's effectively extended until the 1st of June. So it allows some leeway if it's not possible to get access to the relevant body to undertake those medicals. So I thought you might find that fairly helpful. Just moving on to the next slide. First aid, we've touched on this already. I found it very difficult to find sort of practical guidance on what happens in a situation where someone's taken ill at work, or and that could be related to COVID-19, or it could be just general workplace activities that have resulted in an injury. You know, what happens there? And I was struggling until the updated guidance yesterday to find any sort of useful pointers. But I did find useful the guidance for first responders, which is really designed and targeted to healthcare professionals. But I thought the general principles there would apply equally to anyone that's involved in sort of responding to accidents. And the HSE has produced guidance to remind businesses of the need to ensure that they do have sufficient first aid cover for people in the workforce that are still at work. You know, the legal obligations to provide for first aid still remain. And helpfully, it also deals with people who are in the middle of their training for first aid qualifications. HC have explained that they're happy to effectively postpone that training until we sort of get over the crisis. And it's also emphasised that people who are administering first aid should need to have the relevant qualifications. And one of the suggestions from HSE is that businesses could consider sharing resource between each other. So first aiders from one business may, for example, be able to assist another business. The issue with that, though, is that what one business does and might not be the same as another. So that again presents another sort of risk assessment issue. So that first aiders have an idea of what the likely risks are, the types of incident, for example, and what the relevant control measures are. So that's the first aid. Just moving on to the next slide. Home working is probably an understated issue, and I guess I would say that as a home worker, but I imagine even if you're involved in manufacturing, there will be an element of the workforce that is able to work from home, and the government guidance is very clear that that should be encouraged wherever possible. Again, to bear in mind, so that's the guidance. What does the law say? Well, the law is very clear that you've got to ensure that employees, wherever they are working, essentially, are safe and aren't placed at any additional safety risks. And the most obvious one for home working relates to sort of display screen equipment. So using laptops, tablets, etc. There's the particular duties under the display screen equipment regulations, and in summary, that requires employers to train people and provide them with information to be able to work from home safely. And that could be something as basic as being able to set up a laptop and workstation correctly, so you don't have shoulder, neck, muscle pains, etc., or eye strain. And most businesses that have been used to home working are sort of familiar with online workstation assessments. I know certainly I've undergone one of those, so it sort of talks you through exactly what you need to do to make sure that you are sat in the right position, your monitors positioned correctly, etc., to avoid those problems. And also things like taking a break and things like that, but it's often overlooked. And related to home working is that you'll now find that lots of people are at home, isolated from colleagues, isolated from management teams, and just generally others. And just moving on to the next slide, that presents additional risks relating to mental health. And just pausing for a second, the general legal duty to take reasonable steps to ensure safety also applies to its health, safety and welfare of employees. And that's always been the case since 1974. So looking at mental health and welfare is not a new concept. It's just been given renewed emphasis in the last few years. So there's always been a requirement to ensure the welfare of employees, and that would include mental health. And particularly at a time like this, where it's a time of crisis, stress is a risk, particularly if people are recovering for colleagues who are self-isolating. It places sort of increased demands on their workload. And again, people may not feel comfortable with doing additional or doing work that they previously haven't done. And again, that all builds on sort of stress levels, in addition to general worries around feeling safe in the workplace, financial concerns. It all mounts up. So businesses really need to be looking at this carefully to ensure that people don't feel isolated, they feel supported, and you've done everything possible to make them feel included, and it's business as usual. And again, I've gone back to communication, and I think communication is absolutely vital to ensuring sort of good management of mental health. And HSE again have published guidance on sort of management processes and that you can follow to add more structure to managing sort of welfare issues. It is worth reading, but again, my personal view is communication's the most important thing here. So you know exactly what's going on and what the issues are on the ground or at home or wherever they may be. Just moving on to the next slide. So Again, the legal position, there's a piece of legislation which you may be familiar with called RIDDOR. RIDDOR effectively sets out the circumstances when businesses have to report certain workplace incidents. That could include, for example, a fatal incident, or there are particular incidents, so amputation, or if someone's admitted to hospital, for example, for medical treatment. All of those have to be reported. And RIDDOR's quite detailed and sets out exactly what circumstances have to be reported to the HSE, and it sets out the time frame in which they have to be reported by. There's been some discussion here around, well, what happens if an employee is suspected of having COVID-19? Does that mean we've got to report that to HSE under this sort of formal process? And I've just, on the slide, you'll see sort of the HSE's guidance that I've sort of summarised. It was updated yesterday to be a bit more particular, but in essence, the view is that taking the first bullet point, if there's been an exposure in the workplace, so you could think, for example, in a medical context that, or a science lab, someone working on the sort of a strain of the virus, and for whatever reason they're accidentally exposed to COVID-19, that would definitely be reportable as a dangerous occurrence. But that's very much, I think, in a sort of medical context. The other bullet point there is looking at, well, has the employee contracted the disease as a result of being exposed to it at their workplace? Because if the answer to that question is yes, they have been exposed to it at their workplace, then it should be reported under RIDDOR. There are a number of difficulties with that. The obvious one being, well, how on earth do you know if that person has contracted the disease from work? It could have been from the supermarket, for example. It could have been from friends or family. Who knows? And so that's quite a difficult question, and I imagine it'll be quite difficult in a number of circumstances to show that an employee was exposed whilst at work. It might not be, but if they are, then it is reportable under RIDDOR within the time frames. So just moving on to the next slide. So that hopefully has given you food for thought, or at least sort of giving you a refresher of the general legal position, which is very broad. It's very particular to your circumstances and requires you to really sort of forensically look at what activities your business is doing, who, and that's everyone, is potentially affected by that. What control measures are you going to take to deal with that in line with government guidance? And then if you do take those measures, consider what the implications of doing or taking those steps are. Everyone has a role to play. Individual employees, they have a legal duty to take care of their own safety as well as that of others and their colleagues. It goes from sort of senior management all the way through the business structure. Communication, again, in my view, is absolutely crucial. People should know what steps they need to take, when and how. People should take comfort in the fact that communication is frequent. They know you're managing the workplace efficiently and as safely as possible. And again, that helps with managing welfare and mental health issues. It is a rapidly developing and changing landscape, so it's really important to keep up to date with current guidance and developments. As I say, it's worth looking at yesterday's or the current guidance, which was updated yesterday, which deals with lots of the issues we've discussed. And finally, just to emphasize that it's not just risk to physical health, it also includes welfare, So don't neglect the mental health side of it when looking at risk and control measures. So just moving to the next slide, that sort of brings sort of the formal part of the presentation to a close. I'd be happy to take any more questions on any of those issues.
Thanks, Ashley. That was really useful. If anyone's got any questions, obviously feel free to ask Ashley. If you're happy as well, Ashley, we can include your contact details in the follow-up email with attendees.
Yep.
If that's all right, in the presentation in PDF format.
Yeah, sure. Because I appreciate we're talking about fairly sensitive issues that people may not want to talk about openly or on a public forum. So I'd be absolutely happy to take any questions offline.
Brilliant, thank you.
Ashley, it's the other Stuart here, your colleague.
Hi, Stuart.
Hello there, how are you doing? Just to come back on Hayley's point, I was just, whilst you were talking after the discussions earlier, I was having a route around for some advice I got from our data colleagues, and you're absolutely right that none of this disapplies the normal data law, but I was looking at some safety questions where a client was trying to collate safety information around third parties affected by their business. Very different scenario to the one Hayley was outlining, but nevertheless, it's same sort of principles. And I've managed to sort of find this email, which sets out that the ICO has issued specific guidance on implementation of data protection practices in the light of the pandemic. And they're, rather like the HSE, they're saying they're taking a pragmatic approach to the application of data protection law during this period. And then the advice I've had a look at talks about collecting employees of visitors' health data, and it specifically says you're permitted to obtain relevant information about employees and visitors' health, provided the information is limited to what is reasonable and necessary to protect the health and safety of your employees. You shouldn't use this as an opportunity to gather data for itself. So I think whilst the data laws still apply, there is clearly scope for pragmatic information collection, and each scenario a business is thinking about. It's a bit like your comments around risk assessment. You still have to look at every scenario on its own merits and decide whether that's appropriate. But I think it is probably worth having a look at that guidance and if necessary, taking a bit of advice, Hayley, because it may facilitate that as a reasonable proposition in the circumstances of trying to protect your employees.
That's really useful, thanks. So that was the ICO specific guidance of this.
Yes, yes, it is. What I can do is I'll get the guidance sent to you, Hayley, after this, if that's okay.
Yep, great. Thanks very much.
Thank you. That was really useful. Again, any further questions can be fed through afterwards if preferred. So obviously we will send out the slides. We have recorded it as well. So if there's any of your colleagues you'd like to review this afterwards, we'll get this put online once we've downloaded everything, and Ashley's happy with it. So thanks for attending. And just to let you know, we do have a few more webinars planned for this week and next week. So if yourself or any of your colleagues are interested in attending any of our other webinars, they can all be found online on our website. Thanks, Ashley. Much appreciated.
No, thank you very much.
Thanks.
And I'm on time, which is excellent.
Exactly. Thanks very much, everybody.
Cheers.
Bye,
Thank you.
Thanks a lot. Bye-bye.
Bye.